purpose is to reduce obesity in young children under 5. Because today we have children who have diabetes and asthma and heart conditions because they're obese that did not have those health conditions 5 years ago or 10 years ago.
So the purpose of this Nemours initiative was to promote healthier lifestyles as far as physical fitness and healthy eating, to promote healthier lifestyles in regards to having a garden, helping children recognize and identify healthy foods, and changing their eating habits, helping children to be more active, drinking more water, and helping families to be more involved in their child's lifestyle.
The storyboard is telling us about the children. We decided as a team to do gardening. It was important for us to teach the children to eat healthy foods. So the children, the teachers, and the education specialists, Miss Brenda and myself, we all participated. And the children had seeds donated, tomatoes, cucumbers, we had cabbage. We also had the school to donate some vegetables and some different seeds. And the children set up their garden. They dug the holes, they planted the seeds, they got that on their hands and knees. Miss Brenda taught them how to squat. And when she first said the word, the children didn't have any idea of what that meant. And so she set the example, and all the children started squatting and digging holes. And so this is the story of them planting the garden. Once they understood that we were going to do the garden, they were going to plant the seeds, they had to learn to take care of that garden. So the children had a water hose. They had they took turns watering the plants. This was done on a daily basis, twice a day. It became part of our physical activity for outside time. They was running, doing all kind of activities that surrounded them around the garden. The parents were incorporated because they also was there during the time when the children planted the garden and set the garden up. They participated in it. And they also, at the end, we pulled all the vegetables. The children helped pull them. They had baskets. They knew the name of all their plants that they had taken care of and the items that was in the gardening area. And they put them in the basket, and we had harvest day. So we invited all the parents and grandparents came. The children had the food. We did family style. They knew the name of it, and they did a big salad. And the parents and family members sat and ate salad and ate the garden material that the children had grown on their own and took care of. So that's the story of Altamont and everything they did to plant it, nurture it, and then to actually harvest it and actually eat it. And now I have parents that's telling me some of the vegetables that the children grown, they're buying it in the grocery store. The children are actually picking these things instead of candy and junk food. They're going to that area and telling the parents what the name of those things they see in the grocery store. So it was an excellent learning activity for the children.
A lot of kids don't know where food comes from. I think it just comes from the grocery store, that mom picks up, a bag of lettuce. Like, where does that come from? They learn where it came from. It comes from the ground. You have to take care of it. There are particular seeds. So I thought that's definitely what they learn the most.
What surprised me to see at first the children didn't know anything about a garden, basically. But over time, they became more willing to go out and water the plants, and were able to pick their own food and eat it, because before they were like, "Ew, what is that? Radish? Kale?" So now they're like, "I want it. I want to go to the store, Mom. Let's buy it. Let's put it in and let's eat it." So that's surprising with this.
It has been awesome to our program. For one thing, a lot of the gardening activity, nutrition activities, even physical fitness, we were already doing it as a Head Start program. So we obligated to do that, but it took us to a whole different level. And it wasn't just about the children, the parents of what got involved. They learned a lot about prepping meals, nutritional foods that's healthy for their children, that will benefit their children in the long run. And to be honest, the teaching staff, even I took something from it, because a lot of us have medical problems and we teach our children, we know these things, but we're really not practicing them. So when we got a chance to work with the children and you're down on your hands and knees and in the dirt, you're teaching them, it kind of makes you, it opens up reality for you. So I am an example. I've started drinking a lot more water. I'm buying healthy food in the grocery store. I never read labels. I'm starting to read labels. I kind of stay at the middle aisles with all the junk food. I walk around on the outer aisles, and I'm really buying healthy foods and I'm eating healthy food. I haven't been into a fast food restaurant as far as drive-through in 3 months. I never would have done that if it wasn't for the Nemours program. So it wasn't just about the children, it's helping the adults as well.